Hey everybody, this is Unhinged and Oncall. I'm Dr. Chelsea.
And I'm Trish, a registered vet tech. You know us from all the chaos, the clinic confessions, and the absolutely wild stuff behind the scenes.
Starting now, we're adding something new. Pet Parents on Call. You ask the questions wherever you are in the world, and we'll bring you real veterinary insight. What to watch for, what to ask, what to do, and what not to do.
Because your pets deserve thoughtful, grounded veterinary advice, plus maybe a laugh or two.
So whether you're worried, curious, or just love your furry family member, ask away.
Welcome to the Q&A section of Unhinged and On Call.
Yeah. This idea was kind of recently born out of some questions being sent in, and really just some commonalities, I guess, between what we get from pet parents asking us questions at our company, VetCS, and just common things that come up and I think are probably not addressed. You know, you could obviously chat GPT any of these, but I think we can, with both Trish and I being in veterinary medicine, offer some kind of real life practical tips and answers for these, hopefully. So speaking of, if you have a comment or question that you'd like us to address in a future show, easiest way to reach us is to email us at chat@unhingedandoncall.com. You can also, by social media, DM us. I think we're kind of everywhere, right?
Yeah.
Instagram,
TikTok, Instagram.
TikTok.
Yeah.
And you can DM us on those. Or we even have a submission form on our website, unhingedandOncall.com. So you could submit a question there about your pet, and then we could address that in future episodes.
Yeah.
So we're excited to start this kind of pathway because I think it taps into a lot of what we wanted to do with this podcast is to be educational, and also highlight, humor and funny things that happen in veterinary medicine because they are quite common, but also be of value to pet parents and horse owners in just typical veterinary medicine questions, because I think we're all better off if we share insights and things that we've learned over the years.
Yeah.
So,
So we have the first one that we'll bring up. So it's super common. We hear people ask us about it all the time. Is pet insurance. Is it worth it? And what does it typically cover for your pets?
Yeah.
So dogs, cats, and horse insurance too. So this covers all species. My answer is yes. Get the pet insurance or the horse insurance. From personal experience, you will use it at some point.
Yes.
But Dr. Chelsea, would you like to address it?
Yeah, I think this comes into play a lot, of course, in emergency medicine, because those are the times where unfortunately, you haven't planned for an issue, but potentially, say your dog gets out and gets hit by a car or something very dramatic. And what I think is the most reasonable, and I carry this on my horses, is the easiest way to sort out a situation like that is super traumatic and nobody wants to go through that, is to not think about the financials of it and just say, do whatever you can to make my pet feel better. Unfortunately, with how extensive our advanced imaging and diagnostics have gotten, those machines and equipment and the veterinarians and the veterinary staff are working so hard. They have to be paid well. It sucks. It's the elephant in the room, but we have gotten so close to what human medicine can achieve as far as diagnostics and conditions and management of all these different scenarios. But that comes along with a cost. Yeah, 30 years ago, vet care was cheaper because a lot of things we couldn't fix. And so now that's different. But, you're looking at, Fluffy got hit by a car. It's going to be $8,000. If you, I have kids, and there are things that $8,000 could go a long ways to pay for.
Right.
So if you don't have to think about it and you have insurance, then fantastic, because especially accidental coverage is where your pet insurance is going to come into play a lot. We can talk about horses in a second. But the great thing is that depending on the plans, there's a million different companies that offer it. But depending on the plan you choose, of course, your premiums are higher if you cover like wellness care and things like that. But it can range from like dentistry and, all the way up to like surgical issues, hospitalizations. So you kind of choose your risk tolerance. I guess it would be similar to health insurance, is if your risk tolerance allows you to have a high deductible and maybe you put some money away that you're saving on your premiums, great. I think,
and dependent on the breed that you get too.
Yeah.
So some of them, like, with the, just hip, issues or what have you, whether it's a German Shepherd or a Bulldog, right? Think about the type of animal that you have and what they might be predisposed to.
Yep.
Because some insurance companies, there's a waiting period with, if they tear a cruciate ligament or something, they have a waiting period that they won't cover it until, you've been with them for, I think it's like 6 months at first or 8 months or something like that. There's a period of time. So if something happens within that period, you're not covered because they want to avoid people taking advantage of the system
get
in that way.
diagnosed and
right.
then all of a sudden
So
want to
the
do
earlier,
surgery.
the better. Like if you get a puppy, think about
and it's cheaper
insurance.
getting them as a puppy, right? There are, unfortunately, with senior pets and even horses, there are periods where, we all, I think we all understand what insurance is it's just a gamble from, from the pet side, essentially, is the insurance is betting on the pool of people that there's going to be less surgical outcomes and things that are expensive. And so buying and getting the policies early with healthy animals is the best way to kind of minimize costs and then also have protection.
Yeah.
You hit the nail on the head. Having to do a TPLO surgery, like in Denver, is $6,000 a leg, and then more than 50% of the dogs injure the other one within 12 months.
Yep.
So, like, do you have $12,000 right now that you could put towards your dog's leg? And if not, you're dealing with physical therapy and like long-term lameness issues and pain and mobility issues. So it's, if you can kind of take that financial piece out of it because insurance is going to cover it, I think it's quite nice. It's just, of course, hard with multiple pets in the home and things like that. But the alternative truly is to put away a little bit of a fund, and it doesn't have to be earmarked for the pet specifically, but just have money. If you're not going to do pet insurance, have kind of an accidental, like, safe spot for some
safety net,
some money, because it's so stressful to see people going through financial hardship before something happens with their pet, and then their pet gets sick, and the pet may be the only thing that you're holding on to, because that's the only thing you have in your life that's going well. Yes. And then all of a sudden your pet gets sick and you're like literally rock in a hard place, and that's so hard to see people go
adding
through.
Money into that situation just sucks.
Yes.
It just sucks.
So if it, start early, try to get pet insurance, when they're healthy and all that. Yeah. I think horses are a very different ball of wax because you add in horse value. And that's not something we deal with as much in dog and cat world, I guess, is the horses have value. So then essentially they're all layered on top of mortality policies, which is if they actually like colic and die or break their leg or do something, you get the value that you paid for the horse back in your mortality coverage. The layers that you add on to that are major medical, and then there used to be loss of use that was more common, but that's hard to kind of define. So more recently, all we've seen is kind of major medical on top of a mortality policy. Major medical allows for a lot of different things. So usually injury, but stomach ulcers, colic surgery, even just colic, essentially medical coverage. If they go into the hospital and need intravenous fluids just to recover. So also a good investment. And then it just depends, of course, on the value of your horse. You don't have to, I think what people don't know is you don't have to fully insure your horse. So if I've got, and these are theoreticals because I don't buy horses for this much, but say you've got a $50,000 horse, you may only want to pay the premiums and insure them at $25,000.
Yeah.
And maybe that's your line of, okay, I could get a new horse if something really awful happens, or I don't have to check myself and be like, do I have $10,000 to go to a small intestinal colic surgery?
Yeah.
Like yes or no. And you're racking your brain and you're having to make all these very quick decisions, like take the money out of it.
And a lot of times too, there's secondary stuff like that. That's saying that everything goes like textbook and everything's fine. And that's not like if something happens and they have to stay even longer. And then it's, now they're at the hospital for a whole nother week. Like that is, it just has the potential to pile so much higher.
It really
also.
does.
So
it really does.
Scary.
I mean, that's the unfortunate part is, these aren't vehicles. So it's not like you just take them to the mechanic and get them fixed. There are patient to patient individuality and adverse events that happen through a lot of times no fault of anybody, just that they have a reaction to the anesthesia or, or something that makes it really hard for them to recover. So definitely, I think anything, even if you're just putting away money, that's great too. But for sure, pet insurance does pay for itself in a lot of cases. So I think it's worthwhile to think about.
Yep. I agree.
So
green light on the pet insurance, everybody. Yeah. Look into it.
Yes.
Cool. So the next one, do you want to do another question?
Yeah.
Yeah. Okay.
Ready.
So the next one we saw a lot, actually, very common. What are the signs of arthritis in older dogs and cats, and how do we manage it? So how can it be managed? That's a can of worms.
It is a can of worms. And I see that it says older, but I was even thinking, I know a lot of dogs with like elbow dysplasia and hip dysplasia that they're juvenile. Yeah. They're like 18 months old. Yeah. And they've already got osteoarthritis. Yeah. You know? So, that, I think it's just hard because even in young horses, we get OCDs and they get early onset arthritis from it. So it's, I guess it's not limited to older dogs and cats. I think it can be hard, right? We all know kind of what happens to our joints with aging, and how it can kind of creep up on you where it's a chronic repetitive type strain injury or something that creates some joint pain, but you kind of just walk a different way or you figure it out for a while.
Yeah, you adapt. Yeah.
Until you really have to have to address it. Yeah. It's the same in dogs and cats as people forget, they did used to jump up on our bed and now they're not.
Now they can't.
And I'm having to help them in and out of the car. And all of a sudden they stop, we did this 2-mile loop normally and now they're stopping halfway through. I think it's really hard. Of course I see lameness every day because that's what I do, but most people don't see asymmetry and lameness in pets. Right. And so it's even hard, like for me sometimes watching other people with their pets, because I'm like, oh my God, that dog is limping.
That dog is in pain. Yeah.
Yeah. Because you go from a puppy pulling you on the leash to they're walking 10 feet behind you and the owner's just like, or pet parent is just walking,
kind of oblivious
and
to
they're not
it.
paying attention.
Yeah.
And that doesn't mean they're not taking care of them. It just.
Right. It's like that subtle build over time that some people,
it's
kind of just get used to.
Day to day. Yeah. You don't notice the little decline.
Right. Until
all of a sudden they get bad, you bring them in, you give them meds and you're like, whoa, they're like jumping on the counters, and totally doing things they used to do. So it's not anybody's fault to not notice that they slowly are declining. But you just try to think about the signs. I think probably one of the easiest things for me to see as a vet is them going from, especially dogs, laying down in an exam room to standing up. Yeah. If they shake at all in their hind feet or they start to use their nails because they're trying to get purchase on the ground. Right. It's because they're not using their joints as well in their hind end for sure. Yep. And then, obviously it's easy when they tear a cruciate ligament, they're like hopping around, non-weight bearing. And so that's a really severe lameness. And, everyone can see that. So that's kind of easier. I think cats are difficult too, because they're quite resilient, and so they can hide stuff.
They can adapt and hide it and not show it as well.
But I think for cats, I feel like I'm always looking at, are they grooming correctly? Can they jump on surfaces? Because, a lot of times we're wanting them on their play structures and all that. They're jumping high. Well, are they no longer jumping high? Yeah. That's not super easy to see. Right. But they also tend to like lose body weight when they have joint pain and things like that too. So just when you're petting them, like check to see if their body weight is correct. And I guess the opposite to that is if they're overweight, you are taxing their joints.
Oh yeah. Which is such a huge issue.
And there's dogs too. Yeah, there's so many good studies now, controlled studies showing that overweight or obese dogs are on average like a 2-year shorter lifespan. Yeah. Like just, work with your veterinarian and make sure that your dog is getting the correct nutritional plan for the amount of activity they get, because that is the single most thing you can do to help their joints and their overall health.
They don't need to clean your plate every time you're done eating. They don't.
Well, and it's not good for them. That's one of our questions later is it's hard on their GI tract. Yeah. Like, dogs are fine, and we're not going to get into full nutrition on this one. Yeah.
Talk about a can of worms.
That's a true can of worms. Yeah. But working with just on an individual basis, like how many kcals they should consume a day, and changing. And it's like a moving target at all times is especially for my pets, it's literally just like, when you're petting them and being like, okay, do they have a waist? Like,
right.
I don't want to see ribs, but I can feel ribs.
Right.
Just simple stuff. And then I'm constantly changing the amount of food that I'm giving them.
Right. Yeah.
And it doesn't have to be a lot. It just
subtle
goes
changes
up or down. But don't just get in such a rut that and please don't free feed, for the love of God.
Oh yeah.
Please do not free feed.
Yeah. Unless your dog is like super
There are very few
picky,
dogs.
mindful. Like I have 2 dogs, but one of my dogs, she's older now. She's almost 10. She literally only eats at 11 p.m. at night. She's so weird.
She still free feeds?
And she'll free feed, but
sorry, I just said that.
well, no, but it's not like it's because over time she was that way.
Yeah.
So it's not like she grew up doing that her whole life. So we never free fed when she was younger. She would get her food. She would eat it. We'd be able to adjust. And then as she got older, I just saw that she was just like leaving it more and then choosing her windows differently, like as she started to age. So she almost, I probably only fill her bowl like once every 2 days. Okay. And she just chooses, those windows. But I don't feed more food than that, right? So she gets a certain amount of food, and then when she's out,
she
gets the same amount next time, right? Yep. So it's just not like I'm always filling this dish. Like, don't do that. You don't want to just have it out all dogs. The time, just full constantly.
Cats tend to do fine that way, but if you've got a cat that is not fine that way, and it's usually pretty obvious. Yeah. I think especially indoor cats, they're of course more prone to that. Is if they're overweight, their joint health decreases so quickly. Yeah. In terms of management, I think it's actually really cool. There's a lot more, there's so many rehab centers now and things that can actually work on mobility and range of motion and like literally similar to physical therapy in humans, right? Which we've shown like surgical outcomes are so much better if the patient has follow-up PT. It's similar in dogs and cats, right? And even in horses, we have rehab centers that do like wonders for animals. So part of it is, of course, is an anti-inflammatory aspect of it. So it can be oral, essentially like carprofen, which would be Rimadyl. There's a brand name. Previcox has been a great one. Yeah. The COX selective inhibitor, so that you're not risking kind of liver, kidney, and stomach health as much on a daily basis. And then there's all sorts of actually even injectable pharmaceuticals. There's a couple coming down the pipeline specifically targeted for the inflammatory process that comes along with arthritis. But in terms of a management setting and what you can do for your pet, it's essentially like low intensity but frequent exercise. I do think, they probably do. I think dogs do better with orthopedic beds, especially when they're seniors and getting up. Totally. Because we get up the same way if you're not on a great bed, or try falling asleep on the floor with your toddler. Sleep on the floor for 1 hour and get up and walk. Like the pets definitely do benefit from softer surfaces. And then I think it's pretty cool. Some of the omegas that are like 3.
Oh yeah, I agree.
Omega 3, 6s. Yeah. Those fish oils and the studies that are coming out with omega oils and DHA and EPA are incredible. Awesome. So things you can do from a natural standpoint that's not involving injectable or surgical methods is fantastic. Yeah.
There's so many adjunct therapies that you can just add in that are just, they all work so well together. Yeah. Right. Yeah.
So from a prevention standpoint, right. Of course, like MSM, glucosamine, chondroitin sulfate, green-lipped mussels, just preventing joint disease essentially, especially in large breed dogs, is going to be fantastic. And then, of course, we deal with hemp and cannabinoids all the time. And there's the minor cannabinoids can help so much along with CBD as an anti-inflammatory on a daily setting and just helping them. But just as Trish mentioned, it's multimodal. So you're not just doing essentially Rimadyl or Previcox every day. You're taking them on walks and you're maybe you have a PT close to you and you can do underwater treadmill or laser. The cold laser therapy is incredible in dogs. And then, there's literally acupuncture and chiropractic.
Well, and like Chelsea mentioned earlier too, like just preventative when they're younger. So starting to do these things, and especially breed specific too, but maybe you already have some of these things on board and they're only 1. right? Like you start these things early to help try to, at least stall future problems. But yeah.
But yeah, I think there's so many options out there. It's quite encouraging, I guess. In terms of.
And personal plug, if you are interested in CBD, you can reach out to us, and we're more than happy to help with just dosing structures on that, because it does matter if it's, a mild problem or preventative, want that you want to try to start using it for, or if there is a painful side and it is more advanced and you want to explore that for them, we can help with a bunch of that stuff. So vetcs.com. And you'll get me, Trish. I'll help you. You just let me know.
Different.
Yeah, exactly. Yeah.
This episode is brought to you by our friends at VetCS, your go-to for veterinarian-developed CBD and wellness products for your pets and horses. Founded by veterinary professionals, VetCS offers science-backed formulas made with premium hemp extracts to support calm behavior, joint health, and overall wellness, whether you're in the clinic or out at the barn. VetCS is all about helping animals live better naturally. Want to see what they're all about? Head over to vetcs.com to explore their full line of CBD products. Next question is, how can I help my dog cope with anxiety or fear of loud noises?
Ooh. So many cans of worms today. The word anxiety is a lot to unpack, right?
Yeah, it is.
So there's so many different things that go into anxiety, right? So is it something that they struggle with every single day? Is it, a chronic issue for them? Or is it situational to where they don't want to go on a car ride, or they don't want to go to the vet, or people are coming over to your house and they just lose their minds and they're totally fine otherwise, but they just have fireworks. Yeah. Noise phobias.
In thunderstorm season too. And that's, it's really debilitating to some dogs. And so, we talk about like, if right? If it's a situational type anxiety, obviously getting them used to guests coming over. I'm not the best at that. My dogs are quite loud when guests come over,
but they're friendly.
I've tried a lot.
Yeah.
But just getting them kind of like, essentially giving them tools in a way, which is kind of weird, but just giving them structure essentially. And then if it's to a point, of course, where they're like shaking and really fearful and nervous, it's just, the things like turning the TV on and sound so that they can't hear the thunderstorms as much. There's thunder shirts, which work amazing for noise phobias. Getting them in kind of a calm room or a safety room. Sometimes, dogs love bathtubs, and that's okay too. Letting it be, having an environment or a kennel or something where there's potentially even like white noise. I'll set up a white.
Yeah. And I've had a couple clients even this last week that were like, I feel so bad crate training. I'm being mean to it. I'm shutting it in a crate. And I'm like, no.
They like it.
They love it. It is their, if you make it positive from the beginning and make it their safe spot, like both my dogs are in crates constantly. If we are not at home, obviously, but they also choose to be in there. So we leave them open and their beds are in there and it's cozy and they have their food and their water nearby. So they just choose to go and take a nap in there if they want to nap in there. So having it as that comfortable spot for them is a really nice option. And also, just as a side note, if they ever get hurt or injured or they have to be confined for a medical reason later, having them already used to the crate is a total game changer. They're not scared in there, or it doesn't create more anxiety because they're already used to it. So just additional things that, make both your lives easier around the anxiety. And also, please get a positive reinforcement dog trainer. So if there's a lot of things that you feel like are out of your control, or you need a sounding board or any of that, just helping them mentally work through those obstacles and hurdles and all of that. A good dog trainer, a certified, positive reinforcement one can be a game changer for a lot of dogs.
Yeah, it can.
Yeah.
Because they don't, I think we forget too that our lifestyles more now than ever are a lot of times, we're gone for long amounts of time during the day and they're by themselves and all that, versus it used to be more acceptable to have your dog with you a lot more and off leash, I think too. Leash training is a major thing. Yeah. And that all plays into anxiety. If the dogs aren't sure of their surroundings and all that, they're not going to cope as well. And same thing with noise phobias is, what is it? The most out of any day of the year, July 4th are the most dogs.
Oh yeah.
Like surrendered to shelters and missing.
Because they're literally hopping fences.
They're so scared.
They're finding any way to get
They're
out.
just on adrenaline, so they'll do anything. Yeah. Like things that you don't think your dog or cat can do is, and they run away and they get hit by cars and scary stuff. So if you can kind of help them have a safe space in the house, you know, and cope with things like that, then all the better.
And if you have a higher anxiety dog, making sure they're microchipped. Like if they get scared, like the noise phobia stuff, and they're
Tags
running away, tags are updated, vaccines for rabies, all the things are updated. Like make sure you're on top of that for them so that if they do get out, there's a higher chance you'll come across them. Yeah. Hopefully.
For sure.
Yeah.
Yeah. That's so scary.
Dang. Yeah.
Okay. Next question is, my cat recently started urinating out of the litter box. What can I do?
Oof. I'm not as you're more of a cat person than me. Yeah. So I would default to you. Besides my 2 cents is, do you need another litter box? Right?
There you go.
Like add an additional one
that's
somewhere.
A good thing, right? Is I guess the follow-up questions, of course, whenever we talk one-on-one to somebody is, has there been a change in the household? Is there a new baby? Is there a new cat?
Another
or
cat?
Maybe a kitten? Or is there even like an outdoor cat that's messing with your cats?
Right.
Like any sign of stress, and then the cats start kind of spraying. Hopefully it's not like a tomcat spraying. Of course, if they're intact as a tomcat, that's what they do is they spray. So that is kind of your push for spay and neuter early on. And then assuming that they've been well trained to a litter box and have been normal, then you think about, okay, are you cleaning it often enough?
Right.
Are there, going back to our prior question, are there arthritic issues going on? And now that cat doesn't want to go upstairs to use it. So now you need a litter box in accessible regions, probably on every level of your house. I think the most common thing we get, of course, with vet CS and in practice is just multi-cat households are really hard to manage. And so then there's territorial issues that come into play. But remember that the cat peeing outside the litter box is a secondary sign of either anxiety or pain or something else going on. And so you kind of have to like be a little bit of a detective and get through different things to say, okay, why now?
Right.
Is there, you know, there's all these smart robot ones. Did that scare your cat once? And now, you know what I mean? Now they don't want to go in it.
The auto scoopers.
Yes. Or even type of litter. You can change the type of litter.
True.
And all of a sudden they don't like it. They're peeing outside. And so I think, and I really like the feel away pheromones because that's calming.
Yeah.
Usually this litter behavior spraying outside is born out of anxiety essentially. And stress. And so even just doing those little plug-in feel-aways are pretty cool because they have pheromones that are calming to cats. Cats are pretty historically difficult to medicate. And so they're not easy when they get into a stressful situation. It's not like a dog where you're just going to like give it trazodone.
Right.
You know what I mean? Or handle it and get through dog training.
Cats
can obviously be a lot more difficult to kind of change their behavior with. But there are like calming.
Well, and not to plug VetCS again, but we see this all the freaking time. Like it is an extremely common question, and CBD is phenomenal for helping to reduce their anxiety in those situations too. And it's super easy to give. So the like higher potency drops, it's so nice because you only have to give 2, maybe twice a day, or 3 if they're, you know, if they're a little bit weight range, if they're heavier or a bigger type of cat. But you can just add a few drops at a time into their food twice a day and just gives them consistent support, helps reduce their anxiety. And hopefully, you know, along with the other things that Chelsea mentioned, you know, combining all of those together, that just creates a better environment for them to not be as stressed out. And hopefully that helps the problem.
Not having to like pill them because that's
totally, that sucks. Nobody wants to pill a cat.
No, it's not fun.
No.
And then of course, I haven't actually tried these, but there are those diagnostic litters and stuff too, where if they're dumping glucose into their urine, if they're starting to get diabetic or something is happening on a medical front, I would have to research those a little bit better. But for the most part, if it's a new behavior, bring the cat into your vet.
Totally.
You can run a really quick urinalysis and ultrasound and just make sure that there's not a medical reason.
Rule out that stuff first.
There are like a host of different things that can be going on and be causing an issue. So for sure, if you're not finding an issue within the house or a change that's occurred, I would say within really, I don't know, a week to 2 weeks, you should get your cat in, make sure that the urine, urinary tract itself is not an issue.
Right.
Bacteria, infections, things like that.
The sooner you catch it, the better.
Even stones are rare, but cystitis is a big issue in cats. And it's just an inflammatory condition. And talking with people with urinaries, or with cystitis and urinary issues, it is like
freaking painful.
Very life-changing.
Yeah.
So like quality of life questions and all that is you don't want to ignore cystitis in cats.
Yeah.
And a lot of times it is idiopathic, meaning it doesn't have a specific cause. And that only happens after a fair amount of diagnostics to rule out other common things. But if you get into that idiopathic cystitis issue, like then you need essentially medications.
Right.
And you've got to help them with an inflammatory part of that because it's debilitating.
Right.
And it's awful.
Yeah.
And I'm surprised that animals handle it as well as they do compared to the pain that happens in humans. Like, I mean,
where it's just sad because they're just masking it and they
don't tell you
in pain.
Yeah.
Yeah.
So try to take these
Catch it
clues
early.
as like, okay, there may be something medical. And then you can at least rule those things out and then look at behavioral or vice versa. But I wouldn't delay too long if you're not getting, if you're not making progress, I guess, with your at-home management.
Right. Right.
So
Yeah. Do we have time for one more?
I think we do.
Ooh, okay.
Yeah.
What should I do if my dog is vomiting or has diarrhea? Oh my goodness.
This is like all the time.
I know. Yeah.
I love that meme
all the
where
time.
like you snooze your alarm 7 times, but you hear the first gag of a dog at 2 a.m. and you're like,
I've been there, man. And it's like, I'm puking in my bed. And you're like, wonderful.
Why is it always overnight? I do not understand.
2 a.m.
God,
2 a.m. Here we are.
It's always overnight.
It's that noise. I can hear it in the back of my head.
God,
it's the worst.
Yeah, that's probably, I'm a heavy sleeper. That's probably one of the few things that I'll just like,
and we're
snap
moms
out of
on
bed.
top of that too. So just vomiting and
I do remember
kids and dogs. I've caught some puke in my hands a few times.
God,
Sorry, not to divert,
so
but
gross. But I remember a few times like waking up for the kids and then just getting back to sleep and then the dog vomiting.
Dude,
I was like,
no.
I can't handle this.
I'm gone.
You need to pull it together.
Goodbye, everybody. Mom out. I'm out. Oh my gosh.
Can't do everything in the same night.
Man. So do you feel like vomiting and diarrhea go hand in hand or isolated a lot? Okay.
Oftentimes vomiting, diarrhea. I think from a veterinary standpoint, what we really think about is first age group. So if your pet is 2 and under, and this is obviously mostly to dogs, but it can be like linear foreign bodies in cats. They like to chew string and get string stuck around their tongue and all that. If it's intractable, meaning they're vomiting like every 10 minutes and they're starting to just vomit bile or nothing, non-productive, and they're a younger age, or there's a possibility of like toxins, things like that, get your pet in like immediately.
Take them in.
Yeah. The kind of stuff where, my dog puked twice this morning, and they do have loose stools, like you can do what we'll talk about essentially is your at-home care is just like you would do in humans, right? Is we call it NPO, but nothing per os, which means mouth. So no water, no food, no food, at least for 12 hours. You can give them sips of water, but I would wait 4 to 6 hours before even offering sips. This all depends. Again, follow your gut essentially. If you think they're super dehydrated, no, they need to go to a clinic.
And signs of
get
dehydration, right? Like there are signs like skin turgor and things like that,
you can lift up their lip.
Yep.
Should be slimy, just like our gums.
Not
That means
dry
you're
or tacky.
hydrated. If they're tacky, your finger just like sticks kind of.
Yeah.
Or if their gum color is not good. I mean, kind of gum color tells you a lot. So get used to what your dog's normal gum color is, because with pigment, it's hard to say.
Pigmented mouths are
Dog to
harder.
dog.
Yeah. But healthy pink
Should be pink.
Yeah.
Yep. But if it's like we call it bone dry or tacky, like your dog's not hydrated, they're going to probably need some, what we call parenteral fluids, essentially, is anything out of their enteral system or GI system. So it'd be in the vein, essentially. Is their GI tract then needs rest, right? It's inflamed, it's mad. Sometimes it's a simple gastritis, like we call it garbage gut. That's a colloquial term. Is this happens a lot. They get into the garbage or they eat something dead outside and of course, just like we would, they vomit it.
Yep.
Right. And they clear the contents. Don't feed them for 12 hours. And they may want to eat the first few hours. They probably don't. if it's a lab, it still wants to eat.
Yeah. Yeah. They're always going to eat, and you're not doing them a disservice by holding food. A lot of people are like, oh, I have to feed them, and do not feel bad. They will be fine. It's okay. It's that like inherent, like want to feed them. And that's like the table scrap thing from earlier and all of that. Don't feed them.
I'm saying I have to divert. I'm sorry.
It's okay. That's good.
It's like pot calling kettle black, but I didn't do this. It's my husband who is a vet, Dr. Brett Ludke. Dr. Brett. So I was on call over the weekend, conveniently had a colic at 3:40 a.m.
Oh,
half an hour, 45 minutes from my house. So by the time I got back, because I had to help these people if I can hitch up their trailer. It was very annoying. Poor horse. He essentially, I got back to my house at like 5:30 because I had to help this horse get onto the trailer and go to CSU. So I'm home. I get home at 5:30. I'm like, fuck, your adrenaline, everything is going crazy. Yeah. But our kids don't wake up till 6:30. So I was like, okay, maybe I'll get a little bit of sleep. So I lay down on the downstairs couch. All of a sudden, and this is a Saturday morning. Yeah. So we're trying to like train the kids to sleep in a bit. Right. So we can sleep in.
For sure.
And so Brett comes down the stairs and I'm like, what are you doing at 5:30? Because he CrossFits during the week. So he gets up early. Yeah. And sometimes he can't sleep on the weekends. And he's getting Goose down, and Goose is our lab. He's 7 years old. He's licking his lips a lot. And then and I'm just like, what are you doing? He's like, oh, he just puked. So he takes him outside. So I'm like, I get up and I'm watching him. He's not puking anymore. 10 minutes later, my fucking veterinarian husband feeds him.
He's like, here's breakfast.
He's like, what? He's hungry. I was like, I was starting to go to sleep again. Yeah. And I was like, what are you doing? Are you he just puked. Are you feeding him? Yeah. Yeah. He straight up fed him. And of course, because he's a guy.
Yeah. A guy.
Goose didn't puke again that day.
Yeah, then it's fine. Yeah, I told you so.
If it was me or something and I forgot, I'd be like, oh, duh.
I know.
But yes.
That would totally happen to me
and
too.
Just remember it in your brain, people. NPO. So nothing per os. Yeah. Give their GI system a break. Mm-hmm. Back in the day, we used to actually, I think it came in handy quite a bit, was use a little bit of Pepto-Bismol. Dosing is on the internet and it's pretty darn safe. Just as subsalicylate, essentially coating the intestines. Right. Most of the time you really don't have to do anything, right? Because they don't like taking it. It gets pink everywhere. It's just a mess. But the goal of this talk specifically is because I think it's hard to tell, okay, should I take them into emergency clinic?
Right. What do I do?
Is this serious or is this not? Mm-hmm. And that's an unknown, right? And so if your dog is younger and you think it's potentially obstructed, what we're worried about is foreign bodies. Yep. So whether they eat rocks, whether they eat toys, whether they eat baby bottle nipples, and those just are the perfect plug in the bottom of their stomach. Oh my God. So then they're fully obstructed. So it is a very serious emergency and it needs to be taken care of pretty quickly. Yep. And so those things are different. If you're a 7-year-old dog, 4-year-old dog, anything that's not chewing toys,
they don't typically have those issues.
Kind of stop eating things. Not all dogs, but most of them. No, you can probably sit on it a bit. And again, remember, if they're vomiting nonstop, something's wrong. Yeah. But if they vomit a couple of times and they have a couple of those stools, you can do your 12 hours of NPO, then go to a bland diet for about 24 hours. So cook them some white rice. You can do chicken, no seasoning, no flavoring, do small amounts and just start them on a bland diet. You do that for 24 hours and then they're back, right? Right. If you have a history that you just switched dog foods, but you ran out of one and you switched to a new one, then sure, that was on you. Yeah. And your dog is dealing with kind of a flora change in its gut. Right. 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 And so then you go, NPO for 12 hours, let them sip a little bit of water, maybe after 6. And then you go into that. If there's, of course, more than a few days of loose stools, then you need to probably go in and get a fecal run and make sure there's not Giardia or parasites. Yep. There's bacterial overload that can happen. SIBO, there's all sorts of things medically. So the biggest thing you really need to check for is hydration, essentially. And then if your dog is lethargic and not getting up or really just sleeping the whole day, something's not right.
Yeah, take them.
Okay. So if they're bouncing off the walls, they've puked a few times over 4 hours, maybe 3 times over 4 hours, but they're bouncing off the walls and they really want to eat. Yeah. You're okay to watch them at home. We have so many good meds now, especially with like Serenia. It's the best. There's like a cult following with Serenia. So there's all these really cool medications we can use. And then, of course, our job at the vet clinic is to make sure that it's not a foreign body and that there's not, say, like a splenic rupture or something going on in the abdomen, a mass potentially that's finally putting enough pressure on the GI. Those are when your pet's not acting right.
Right.
So if you notice a change, just that they're quiet and slow and sleeping too much, time to bring them in, and we'll get some imaging and blood work. And
if it goes the imaging and blood work route, this last question of ours goes back to our first question, is that your pet insurance may come in handy during all of this too. So it's full circle.
This is kind of what that's for, is it could involve a day or two sitting on fluids. Could involve a exploratory surgery. So that's okay. A lot of times the owners, when we get foreign bodies, the owners don't even, of course, you don't notice a toy that's missing, or there are rock eaters. Like, you can't count the number of rocks in your yard.
I do not trust my bulldog. I watch him. I think he's a rock eater at heart. Like, he hasn't yet, but I know one day.
And that's the worst when you have to pay, especially when it's happened multiple times. And you have to pay thousands of dollars for a rock eater.
I was talking to a friend of mine recently, and and a client's lab ate rocks 3 different times. So it was 3 separate freaking surgeries to get the rocks out. Then what they did was completely landscape their backyard, and they had to take out all the rocks because they were like, expensive. Well, yeah. So now it's like, what, the $20,000 dog?
Yes.
Like, after all that said and done, like, that's so much. But
you know what that is?
Yeah.
That's love.
Yeah. Unconditional love.
Unconditional love.
But that's like, you kind of recognize it about them. Like, he kind of likes to eat shit. Like, are you like,
you got to change what you're doing.
Yeah.
I mean,
you got to pay attention.
Yeah. What is that? Fool me once, shame on
another
me,
saying.
Shame on you. What is it? Fool me twice, shame on me.
Shame on you. Fool me twice, shame on me.
Shame on me. So
I had to think through that one.
I don't know why that seems,
sometimes I have to say
that
it
a lot.
slowly.
I don't know why that was hard. Sometimes my brain doesn't work. But yeah, just obviously just noticing your pet's normal activity. And then if things are awry, of course I would take them. And the other cool resource I think that's really coming to is there's a lot of, one of the things that is good with COVID is there was a little bit of a relaxation with the VPCR, so valid patient-client relationships. And so there is telehealth options.
Totally.
So like especially if you're in an area, and this has happened a fair amount with friends and family members of mine, where you're traveling with your dog and they get into fucking chocolate, and you just need someone to calculate. There's literally all these chocolate calculators, but it's different per type of chocolate. If you just need a hand and you can't get a hold of your vet clinic at home, or they don't see emergencies or answer calls, there are telehealth options.
Yep.
And those are like registered vet techs. There's even DVMs on there. The other huge thing people don't know about is animal poison health line.
Oh, the poison control hotline.
And so
those are all technicians too.
Yes.
That's perfect.
It's incredible. So if you for sure have a known toxin, especially like an anticoagulant, like rat bait, things like that, give them a call. They are to the nth degree detailed. I had someone actually complaining that they had to pay for a call the other day.
Come on.
It used to be $79. I think now it's like $99 or $100. These are qualified veterinary medical professionals that are answering your call. And I'm talking, they will talk you through the entire thing. If there ends up being a toxin and we need like an antidote, I don't know why I said that so weird. They'll follow up at the veterinary clinic. This is not just like a 10-minute conversation.
This is worth it.
They see it through. And what someone was thinking the other day is that it's subsidized by the government.
Whoa.
Because they were like, and at the end they charge me. I was like, well, fuck yeah.
Freaking come on.
You have a pet.
You own the pet.
You're responsible for taking care of the pet.
Exactly.
Your pet got into something.
Yeah. This is nobody's issue but yours.
Do you think this would be free?
Yeah, exactly.
Yes. If you call poison control for humans, it is free because it's subsidized.
Yes.
But come on, people. There is a line. Because you are the guardian for this pet.
Seriously. And what was cool too is Lainey, who was on our show a little while ago, she was doing, remember she was doing some telehealth. She's obviously an LVT. I think she's double registered RVT too, but she does like just phone services. Yeah, like a concierge thing. And she just has people call in and when they're unsure and she talks you through it of like, do I go or not go? obviously there's probably a fee for that too, because you have, once again,
You're getting a professional.
that's telling you yes or no. And if you don't want to do that, take them in and pay the vet bill.
And 24/7.
Yeah.
I mean, these,
Yeah.
I'm saying these concierge and answering services are available
All the time.
and they're not going to tell you to do something that you shouldn't do. They're,
Right.
They're kind of a sounding board.
Right.
Like think of it as
It's
just
worth it.
calling before. Because yes, when you get to an emergency clinic, you're going to have to give them your credit card.
Yes.
This is how things are
Yeah.
today.
Yeah.
And it's to pay for the clinic
Yeah.
and the payroll and the staff and the medications.
Expect it. Yes. Yeah.
Like
yeah.
that is how, when you go to pay for groceries, you don't leave without them or leave without paying. Sorry.
I just said that to somebody last week. You do not go to the grocery store and walk out with your $200 in food without paying.
I don't
Like,
understand why people think
No,
this is
and
different.
don't be a jerk to your
Yeah.
vet staff. Like
Yeah.
they're trying their best and they
They're
love
working,
your pet. Like
they're
they're
probably
trying.
working. If you're going into an ER clinic, they work
Overtime.
overnights. They work
Yeah.
shitty hours.
Yep.
They're working long hours.
Yeah. And they're coming
So-
to greet you with like a smile and understanding most of the time, being like, how can we
Yes.
help you? Like
Yes. So,
we can make it easier all around.
but yeah. So it's not that urgent cares and ERs are evil, right? They're
Yeah.
literally just making it work.
Yeah.
And so the people there are also, just like an ER for
Yeah.
humans,
Superheroes.
they're seeing the worst of the worst, right? And you have to obviously thank them and they have
Yeah.
to be well compensated
Yeah.
for their skills.
Yeah. Yes.
Emergency medicine
Yeah.
veterinarians are the smartest people on this earth.
Yep.
Like, they know how to handle.
Off the cuff.
Yes, it is crazy. So, I mean, you didn't, for sure in veterinary school, those were not the slackers. The people that went into emergency medicine are quick as all get out. And they'll help you with their pet.
Yep.
So if you have any questions, you can use one of those services or go into your emergency clinic.
Yep.
And they're going to triage, right? So they're going to triage importance. If there's a patient seizing or one that's been hit by a car or
Yeah.
something awful, those will get in first
Yep.
because those are more dire. We all have essentially like lists and rankings for how emergent things are. And yes, if you have to wait a few hours, that's because it's something that can wait a
Right.
few hours.
Right.
And
Yeah.
it's
The hit by
unfortunate
car goes
timing.
before your
It
dog's
does.
diarrhea.
And
Yeah.
trust me, if
Yeah.
your dog's hit by a car, you want your dog seen first.
Exactly. Yeah.
Like that pneumothorax has to get resolved before your dog's been limping
Correct.
for a week.
Correct.
And now it's a
Now
problem.
yes.
Right?
Yes.
So just keep it in mind, people.
Be
This is-
mindful.
This is not, personal. It's
Yeah.
not anything like that. It's just getting into what pet do we need to help the first.
Yes.
essentially.
Yeah. Yep. 1000%.
So, yeah. But we welcome your questions. We got on a weird tangent.
Soapbox.
Sorry, guys.
We are stepping down from our soapbox.
That was a little heated. Sorry.
I knew it was going to happen at some point with one of these because all of these, like I've said like 3 times, are cans of worms. So there's so
Yeah.
many things that go into all this stuff, but
It could have been worse.
Yeah.
We stayed away from vaccines, people.
oh yeah, it could have been way
And-
worse, you guys. You don't even
and
know.
and raw diets. Those were
We're like, we'll probably not talk about those ones yet.
we're being a little bit
Maybe
of
me
pansies
and
over
Chelsea
here.
need like, I don't know, CBD
do
before
we need? Red Bull? Do we need Red Bull before we talk about
I'm
those?
talking about CBD. She's like, do I need a Red Bull? And I'm like, I need to calm down.
I have to be amped up to talk about those things.
I've seen Chelsea amped up. It's worth it, you guys. It's worth it.
Way more of a soapbox
Yeah.
for those.
Well, we love doing
Maybe-
these questions. So
yeah.
send us more. We would love to talk through a bunch of different stuff and horses too. We'll do a
Yeah.
horse Q&A maybe sometime. That would be super fun.
Yeah.
But send us your questions because we'd love to go over them.
Yeah. All right. Thanks, guys.
Thanks, guys. Bye.